In the first video in this series, we discussed the Social Security disability programs, how to apply and qualify for them. In this segment, Jennifer and I will illustrate how a person receiving Social Security disability benefits can obtain Medicare benefits. In addition, a brief explanation of the various parts of the Medicare program will be provided. Medicare was created by Congress in 1965. Medicare is the nation's largest health insurance program, currently covering about 45 million Americans. It is a health insurance program for people aged 65 and older. People under age 65 with disabilities who have been receiving Social Security disability benefits for a set amount of time. In most cases, you must be entitled to disability benefits for 24 months before Medicare can begin. So, the earliest you can receive Medicare is usually the 30th month after becoming disabled. For example, 5-month waiting period for benefits to begin plus 24-month waiting period for Medicare equals 29 months before Medicare entitlement begins in the 30th month. However, there is an exception. The 24-month Medicare waiting period does not apply to people who have amyotrophic lateral sclerosis, ALS, known as Lou Gehrig's disease. People with ALS get Medicare the first month they are entitled to disability benefits. This provision became effective on July 1, 2001. Now, Jennifer will provide an overview of each part of Medicare.
Medicare has the following parts. Part A helps pay for inpatient hospital stays, but also helps cover skilled nursing care, home health care, and hospice care. Part B helps cover medically necessary services, like doctor visits and outpatient care. Part B also covers some preventive services, including screening tests and shots, diagnostic tests, some therapies, and durable medical equipment, like wheelchairs and walkers. Part C is another way to get your Medicare benefits. It combines Parts A and B, and sometimes Part D, prescription drug coverage. Medicare Advantage plans, sometimes called Part C, are managed by private insurance companies approved by Medicare. These plans must cover medically necessary services. However, plans can charge different copayments, coinsurance, or deductibles for these services. Part D Medicare drug coverage helps pay for outpatient prescription drugs. Many people with limited income and resources will get extra help paying for prescription drugs. Mr. Benefit, what do we need to know about enrollment in Medicare?
You are automatically enrolled in Original Medicare when you have been entitled to Social Security disability benefits for at least 24 months, or the first month you are entitled because of ALS. You should receive a Medicare card in the mail about 3 months prior to your 25th month of disability benefits. If you have ALS, you will get your card about 4 weeks after you are entitled to Medicare. If you do not receive your card, or if you have any questions about when you should be receiving your card, you should call 1-800-772-1213 or your local Social Security office. Once you receive your Medicare card, you must decide if you want to keep Part B of Medicare. Some people may not need Part B. For example, you may have health care coverage under a group health plan based on your own current employment or the current employment of a family member. Before deciding, you should check with Social Security or Medicare to be sure you won't be charged a higher Part B premium for late enrollment if you later decide you do want Part B. Instructions are sent with the Medicare card explaining what to do if you do not want Part B. If you decide you want Part B, you can choose to remain with Original Medicare or select another health plan option. You also have the option to enroll in Medicare Prescription Drug Coverage Part D. Now, let's learn about health plan choices.
The same Medicare health plan choices are available to people with disabilities as those available to people age 65 and older, except for those with ESRD. You may choose Original Medicare or a Medicare Advantage plan or other Medicare health plan if one is available in your area. You may also join a Medicare drug plan. Enrolling in a Medicare drug plan is optional, but can provide substantial savings for people with chronic medical conditions who may be taking multiple prescription drugs.